we have actually a seminar, face-to-face seminar today. So that will actually start now. That is actually 8 to 12. However, so I need to do something about our discussion. So nagpaalam ako ng kahit isang oras lang. Okay, so I hope you will listen so that we could finish discussing at least the endocardium. Ayan, so while waiting for the others, may I hear some of you or one of you to give a short recap of what we discussed last times sa pericarditis, I guess. So pericardium, can anyone at least short 1 minute review or recap of what we discussed last meeting? Julen, are you there?
Yes po, Doc.
Okay, sige. Give me a short. Yeah, good morning. By the way, good morning, everyone. So before we start the endocardium, please give us some recap of what we discussed last meeting.
Doc, yung sa pericardium po, yung mga primary diseases po nun ay rare po. Tapos yung lesions po, secondary to diseases, processes of the heart po. Tapos, Doc, yung mga lesions po may pericarditis, hydropericardium, tsaka po hemopericardium. Tapos po, Doc, yung isa po sa na-discuss yung hardware diseases po, which is yung traumatic pericarditis po. Tapos common po siya sa ruminants. Kasi cause po siya ng mga penetration po ng mga sharp objects po.
Yes.
Tapos po, Doc, yung isa pa po is yung cardiac tamponade po. Yun po yung hemopericardium follows after po ng rupture po ng great vessels sa heart po. Tapos pwede po siyang mag-cause ng weakened blood vessels walls po. Yun po, Doc.
Okay, so thank you, Miss Gillen. So last time we discussed on pericardium, and we have a lot of discussions there, especially some of the inflammatory conditions and non-inflammatory conditions, particularly on the perfusions. Yeah, so I think Miss Gillen have mentioned about the different possible expectations once pathogen enter the pericardium or infect the pericardium, in which she mentioned about mga different pericarditis depending on, sorry, I don't have my video. Depending on the inflammatory exudates that are present, okay, on the affected pericardium. And of course, what else? Yeah, we had a little discussions on the hardware disease, in which one of the most common, the fibrinous pericarditis, one of the most common lesions that can be observed in the pericardium. Okay, so most of the time, this is caused by pathogens which are entered hematogenously or from traumatic conditions. No, that's how Miss Gillen also mentioned that in hardware disease could traumatize, okay, an area of the pericardium or an area of the or on the surface, okay, apex of the surface part of the heart that could penetrate the pericardium. Yan. Okay, so the last discussion, thank you, Miss Gillen, for that. Now, the last part or the last layer of the heart that will be discussed, okay, in terms of the different layers from the outside papunta dun sa inside is the endocardium. Now, so I've mentioned about your myocardium, your pericardium, or the epicardium part, which is the visceral pericardium, and now the endocardium is the innermost. And then last meeting, I've showed you the what do you call this one? The subendocardial layer. So yan. So these subendocardial layers I've mentioned about. If you are familiar with the group of cells here, this is a Purkinje. Okay, cells here which are very important, no, lalo na sa mga conductions. Yan, so conductions, especially involving in the current, okay, doon sa nervous, yan, or doon sa chemical, okay, and contractile activity because of the conduction. Okay, so which triggered by mga neurotransmitters. Yan. Okay, so the endocardium is the most internal layer, and it has the contact, okay, the constant contact with the blood. Yeah, so it lines also the ventricles, the valves, and the atria. So the three layers, I've mentioned this one, I guess. The endothelium, which is the innermost, the basal lamina where the endothelium lie, and then the subendothelial connective tissue is just behind or underneath the basal lamina. In this part, the subendothelial connective tissue, and in the subendocardium, where you can find the Purkinje cells. And then, of course, afterwards is your myocardium. Now, for the endocardium, these lines the chambers, I've mentioned about that, and other structures that can be found in the endocardium are the chordae tendineae and the papillary muscles. So this picture shows you here the endocardium and the chambers where this layer has the most contact with the blood. Okay, so the Purkinje fibers dun sa previous pictures natin, so this is the Purkinje cell. So you will actually see this one always in light microscopy, especially if there is a cross sections or longitudinal sections, you of large cells. So at the subendocardial region, that's the Purkinje cells, no? So the primary endocardial disease might be classified into non-inflammatory disease, some idiosyncratic or unknown cause of the disease, and most of the time it is non-common. So in our previous discussions, the most common means or portal of entries for possible infection, okay, or diseases in the endocardium is through hematogenous, but it could also be through, or it could also be penetrations from the other layers, okay, depending on the exposure of the other layers from some pathogens. And if it is hematogenous specifically, it will affect the endocardium. So if you have heard also about parasitic infections, so since they could lodge in the valves, okay, somewhere in the ventricles or the pulmonary artery and pulmonary veins, so I think you are okay, heartworm na sinasabi. So you have I think you discussed this one in your parasitology, in which this could engorge, this could obstruct, okay, the pulmonary artery, which could extend from yan, so papaganyan, no? So especially on the adult worms, yan. So this is the endocardium. Normally, the picture of endocardium is pinkish, glistening, parang pink to gray, glistening, and no other structures that are firm or any abnormal, okay, growth that could be found in the lining. Ayan, so it should be the endothelium lining or endothelial lining lang ang makikita nyo, or mesothelial lining lang ang makikita nyo. Okay, this is a picture of a normal bulb. So once you open and assess for the morphological picture, in a normal morphological picture of the different structures of the endocardium, particularly of the bulb, so ganito yung itsura niya. So it's like a sheet, ayan, which can be found in between sa mga pulmonary artery or just after the pulmonary veins. Yan. So you have the aortic valve here, you have the tricuspid valve here. So this is how it looks like. So definitely in normal picture, it's more of transparent. However, they are firmly attached, okay, to a certain attachment on the parang boundary of each chambers. Yan. So if ever you can see this translucent, okay, translucent bulb that to become thickened, okay, so that will be the time that will give you that that particular structure have been exposed to some injuries. Now, for the endocardial diseases, so as I mentioned this one, primary or non-inflammatory endocardial diseases could either be fibroelastosis, particularly yan, endocardial fibroelastosis. So later we will see what animal could be more susceptible to fibroelastosis. Another is valvular endocardosis and blood cysts. Take note, here is endocardiosis, and endocardiosis is different from endocarditis. That's why one of its description here is non-inflammatory. Endocardiosis is more of degenerative. Yeah, it's more of the, degenerative changes. Okay, another is blood cyst or like hematoma. Okay, the secondary endocardial disease may be composed by mineralization or endocarditis. Yeah, so nandun na yung endocarditis natin is more of inflammatory condition. And the last one is miscellaneous endocardial diseases. So these are the three classification of endocardial diseases. Now let's start with your endocardial fibroelastosis. So the pathophysiology of the endocardial fibroelastosis begins from an exposure to changes, hemodynamic changes, particularly of edema. So there's a progressive edema of endocardium. So if there is accumulation of fluid within the endocardium, that will lead to fibroblast proliferations and will increase the amount of collagen and elastin in the endocardium. Take note that collagen and elastin are connective tissue. Okay, so in that way, now you may think of a possible organization. Okay, so you see there is connective tissue deposition in this one because of the progressive edematous status. Okay, so in your general pathology, one of the consequences of a progressive edema could be an organization of the edema. Okay, so in here in the fibroelastosis, so there is a progressive edema in which the collagen and elastin. So thinking of the structure or thinking of how collagen and elastin will look like once collected on that area, so medyo magiging firm. So in that way, if that particular area becomes firm, then the contractility or elasticity might be affected. Okay, so what will be the consequences or effect? There will be restricted myocardial motion. Okay, I've told you about how it will be affected because of the collagen and elastin deposition. So hindi naman siya for contractions. So if that happen, no, that will lead to decrease in heart output. So it will affect the conductive and contractility of the heart function. So if that happens, especially if that will progress or continuously develop, that could lead to a worse picture called congestive heart failure. And one of its lesions that can be found in endocardial fibroelastosis is jet lesions. The jet lesions here is just like thinking of a stream, okay, water in a river, tapos masyadong mabilis yung flow, and then yung parang yung area, on that area where water or where the pressure flow, okay, na parang daanan ng tubig, or which the turbulence of that, because it happens to be unsteady. Okay, so steady lang kasi siya. So, and then the push of the pressure of the fluid, okay, that will go through, no? So yung parang area lesions produces called the jet lesions because of the pressure turbulence of the fluid that pass through it, because it has the inability or inadequacy for it to contract. So there is no movement. So nagkakaroon ng development of lesions because of the pressure turbulence on that area. Okay, so remember your fibroelastosis progressive edema. So there is hemodynamic imbalances here. So another, we have also a fibrosis and fibroelastosis. So I mentioned about fibroelastosis, which is the deposition of collagen and elastin. The fibrosis more of the activity or increased productions or fiber production because of the increased number of your fibroblasts. Okay, so the acquired localized endocardial fibrosis, which will produce jet lesions. Dito kasi di masyado makita, but definitely para siyang wavy, okay, na parang may mga anong tawag mo doon? I forgot how it will be described, no? But thickened and parang meron siyang ano paano sabihin yun? It's more of like not excavation, but para siyang molded. Okay, so may molded kung saan pa dumadaan, yung parang may remnants on nadaanan ng pressure ng blood. Ayan, so I've told you about the turbulences of atrial ventricles. So, damaging the endocardium yan. Okay, so the gross picture is that, okay, I'm sorry, it's here, it's a corrugation. So, the corrugated surface or thickening surface. Corrugated in terms para siyang, meron siyang mga winding. Yan. So, thickened winding areas in the surfaces of the endocardium because of the turbulence or abnormal turbulence or pressure of blood that goes through to that passage, okay, doon sa area na yan. So that's how it describes jet lesion. Okay, so that could be fibrosis or fibroblastosis. Fibrosis will be developed because of its continuity, okay, of status. Okay, so another, the clinical relevance. This could impair, yan, in our first or second slide, describing fibroblastosis. So one of its effect is congestive heart failure. So the clinical relevance here, so it was mentioned here again. So, or it is mentioned here again, there is an impairment, okay, in the reduced stroke volume. Yeah. So this is the behind of the congestive heart failure. So impairment and reduction of the stroke volume because of the elasticity, because of the depositions of the connective tissues. So grossly, ganito yung tsura niya because it is already thickened. Okay, so it could be a secondary to cardiac dilation. Cardiac dilation, it is a long-term development of how the heart could try to compensate, okay, for a continuous stimuli. Then grossly, yeah, there is a diffuse thickened with rough corrugated surfaces. So thank you for this one. May rough corrugated surface for its descriptions. Now, this is common in particularly of the Burmese breed. Yeah. So this is one of the breed predispositions. Histologically, there's abnormal deposits of collagen. So paulit-ulit lang to for you to remember what could happen or what could be described in a fibroelastosis. So as you can see, I hope you still remember how collagen and elastin will look like under histological description. So meron tayong mga pinkish, and if you will notice here also, there are a lot of fibroblasts that can be deposited. In this picture, you can see the pinkish and mga strands kasi to, no? Collagen and elastic are fibers. Ayan, so pwedeng mga thickened fibers. Collagen is more thicker than the elastin, okay, fibers, but definitely they are fibers that came from your mga fibroblasts, okay, the productions of these fibers. So see how thick, okay, the part of the affected endocardium. Okay, so another, we have the myxomatous valvular degeneration. Or take note, we are talking about non-inflammatory conditions affecting endocardium. Okay, we have the myxomatous valvular degenerations. So these are common in dogs, particularly you have this breed. What breed is this? Yeah, it's a beagle. So other than that, toy and small medium breed dogs, Cavalier King Charles also can be affected. Ito yung paborito ni doon sa British, sa kingdom ng British, no? They do love Cavalier King Charles. Okay, so this usually found in the mitral valve. So when you hear mitral valve, we are talking about what part ng chambers? Two chambers, the left or the right?
Left po.
Okay. Okay, so that is how it will be located for the mitral valve. So mitral or the bicuspid valve. Okay, so where the locations or the point of reference nyo for myxomatous valve degenerations is mostly found in the mitral valve or the bicuspid valve. Okay, so next, so the characteristic of the lesion, so you can see here, then meron pang konting may mga myxomatous degeneration. Okay, so characterized by nodular thickening of the valve with smooth shiny surface, this one. So yan. Ayan. So parang may hematospasm here, no? But this is the affected valve. So this is how it looks like. So this is a portion of endocardiosis. Ayan. Okay, the degenerative, ayan. So this is a degenerative conditions. So thickened nodular valve, okay, which is composed of loose connective tissue, or let's say mga areolar connective tissue. So this is how it looks like. So this is a myxomatous nodular valve lesion. Okay, that's the lesion. Okay, so what could be the possible sequel, okay, or yung impact? Okay, so in the myxomatous valvular degenerations, this could lead to rupture of the chordate tendinae. So ito yung mga parang fiber, or like parang maliliit. Okay, so this is parang cord. Yan, that's why it's called the chordate tendinae. So it is recommended to open the left atrium kasi we are talking about this myxomatous, which usually found in the mitral valve. Kaya sa left atrium tayo, in between the ventricles, no? So you will notice there, okay, so meron tayong problema. Okay, so meron tayong makapal. So there is thickening of the valve here. So when you notice that there is something wrong on this part, you will notice that a particular water formed in the portion of the ventricle and atria. Okay, so ito yung isa sa mga possible conditions that can be expected if there's valvular degenerations that also reflect a rupture of the chordate tendinae. Okay? So, kapag nagkaroon ng ganon, then it will affect the rhythm, okay, of the heart. So, affecting also again the rhythm, okay, the rate and rhythm, okay, of the heart. So, valvular endocardiosis, this myxomatous, but it could lead to the development of this valvular endocardosis. So, ito mas makakapal, and there's a reddish portion. Okay, so the generating valve, okay, at this portion. So looking at this valve, okay, yung opening dito ng atrium to ventricles, so the valve between both are affected. Okay, that's the valvular endocardosis. So it's more or like descriptions also of the myxomatous one. Now, the valvular have the term cyst here, so meron tayong mass. Okay, so particularly common in cows. However, these are found incidental findings. This cyst may rupture, especially if it is a lymphocyst, then it will be absorbed. So wala namang problema, and it will be disappeared. Now, for the hemocyst, when the content is blood, it could be possible, especially kung maliit lang naman, and it cannot hinder, okay, the activity or the flow of the blood within the chambers, then walang problema. However, if this become an hindrance that could obstruct, then that will be different. Okay, so it will affect the activity now of the heart. Okay, so this is how it looks like for the valvular hematosis. It appears okay, and of course, the lymphocyst is white. So ito, madali lang itong mapitak. Ayan, so kaya it could be absorbed. Some hematocysts also, it could be absorbed. Ayan, depende lang talaga, sabi ng other references, if hematocysts are also complicated, not complicated, but contaminated with parasite. Ayan, so isa pa yun, that's different also. Lang na bumuo lang dito because of some hemodynamic, okay, changes. But definitely, isa sa kanilang, one of its fate is to be reabsorbed. So organized, or it will be reabsorbed. Okay, so another picture, ito medyo grabe lang ng konti because the picture of valvular hematomy here becomes organized, medyo tumigas na siya. So if this talaga tawag ito matatanggal dyan normally, then it could affect. Okay, so pwede hindi na siya matanggal. Ayan, na pwedeng mag-obstruct. Okay, Okay, next is endocardial mineralization. So this is different from the other three. Okay, in the mineralization, so we have the term there, mineralization. So we've mentioned about mineralization in our previous discussions, affecting also the pericardium. Okay, so the endocardial mineralization is abnormal deposition of calcium or mineral in the endocardium. And of course, arteries. So it could either be metastatic or or dystrophic. So I asked you previously the differences between metastatic and dystrophic. So metastatic is more of the abnormalities in the circulating calcium. Okay, while in secondary calcification or in the dystrophic is the liberated calcium ions from deteriorated, okay, adjacent necrotizing cell or yung nasirang cell. So that's how it's or being differentiated. But definitely their lesions appear the same. So there are streaks, para siyang powdery. Ayan. So ganun yung mga tawag dito, kanyang lesions. Okay. Upon checking through postmortem. Okay, so that's why I mentioned about para siyang powdery because it appears gritty flakes once you touch it and try to mince. Okay, that particular roughened lesion. Okay, so differentials for the cardiac mineralizations, you need to check and assess in the production or in the development of mineralizations. Could either be non-inflammatory because it is most due to mga nutritional deficiencies or nutritional hypervitaminosis, yan. Or cachexia brought by some chronic pathogens, mga, okay, since it's Ionis and tuberculosis, mycobacterial diseases, or uremia. So I mentioned uremia in our previous discussions. Kasi in uremia, this is the end stage condition of kidney failure in which waste products are not able to excrete properly. Okay, and it will be distributed or circulated. Happen all the soft tissues where blood has yung constant contact. Okay, yung mga waste product here, mga ions or anything that could lodge somewhere, okay, ay pwedeng mag-necrotize and then pwedeng mag-mineralize. So because of those byproducts, okay, of destroyed mga calcium. Yan. So this is a picture of mineralization due to uremia, okay, in dogs. So you will notice here the streak, long streaks of white. Ayan. Surface of the endothelium of the endocardium. So by the way, this is just one part where lesions of uremia can be found. It could be confirmed by checking also the other portion, okay, of the animal's body. But definitely in mineralization, ito yung kanyang itsura. Okay, especially if it is caused by uremia. So one of your differentials, if you see mineralization in the soft tissues, could be uremia. Okay, so that's the non-inflammatory conditions. Now for inflammatory conditions, so definitely it is called endocarditis, most frequently caused by pathogens, particularly of bacteria, fungi, or parasites. So I mentioned about microfilaria or yung heartworm natin, okay, a while ago. So according to locations, endocarditis can be classified as valvular endocarditis affecting the valves, and of course, mural endocarditis affecting the myocardial wall. So according to gross appearance, that can be vegetative depending on the development or distribution of the lesions affected, or ulcerative. So in terms of ulceration, so there's deep excavations on the area affected. Okay, so vegetative, cauliflower-like. So that's how you're going to describe a vegetative lesions. Okay. So clinical, so ito yung clinical manifestations. There is pyrexia, lameness, and of course, there is a murmur. Okay, so affecting the rhythm. okay, of the heart because of these inflammatory conditions. So depende pa kung anong cause, either bacteria or these fungi or parasites. Okay, for valvular endocarditis, so I mentioned about bacterial etiology or a sequel to bacterial septicemia. Ibig sabihin, if the pathogen that enters the animal has this septicemic behavior. Okay, may systemic behavior, the systemic status of infection. Yan. So it could possibly affect also the endocardium. Okay, so effects include stenosis or partial blockade because of the lesions that could develop. So I mentioned about vegetative lesions. So yung vegetative lesions na to, if become large, thicken, so it could obstruct, okay, the area of the valve. And valvular incompetence. That valvular incompetence, so since the valve that we mentioned about as a translucent, ayan, structure now become thickened. Tapos may mga masses because of the vegetative lesions, then it will lead to incompetence, okay, to its role. Okay, so di ba, the major role of the valve is to prevent. So this appears like a protection that prevents the backflow of blood from one chamber to another, or the regurgitations. Okay, it prevents the regurgitations of oxygenated blood from one chamber to another. Okay, so this may involve the walls, okay, the mural endocarditis. So aside from the valve, it also affects, or it could adjacently or develop or progress into a mural endocarditis. Okay, so as an example, so we have here bacterial valvular endocarditis. So through septicemia, it will lodge somewhere in the valves, and that will cause valvular damage. So if there's a valvular damage, that damage or the lesions could be detached or dun lang sa area na yun. If that happens, no, if there is a thromboembolism, then it will be circulated, trap somewhere, kung hindi man sa heart or somewhere else in the parenchymatous organ, that will cause infarction. So that is how it looks like, the pathogenesis and of course the sequel of the possible impact of that particular valvular endocarditis. Now, some pictures showing you a very rich valvular endocarditis with blood, clotted blood. So this is the valvular endocarditis. So showing you a thickened valve with irregular surface, okay, thickened regular surface, which appears rough, okay, and the smoothness and translucency of the valve is already gone. Okay, so this is how it looks like. Okay, for vegetative valvular endocarditis naman, ano ulit, it is more of cauliflower description. So aside from a simple looking at thickening of the valve, now for a vegetative is more of a progressive and well developed because of the cauliflower-like formation of the lesion. So as you can see, very thickened, yellowish, yeah, so hard, and then you will not actually see now the translucency. Okay, it's more of like thickening na, parang it looks like a muscle, but then definitely it's not a muscle, no? It is the tissue, okay, connective tissue, at the same time the pathogens produced in this valve. Okay, so commonly found in a pyogenes, Treponella pyogenes infections, and awfully affects the right atrioventricular valve. So yung kanina left, pag right naman, so dito tayo sa, syempre nandun na yung right, no? Okay, dito tayo sa AV valve. Okay, so caval thrombosis, ito yung isa sa mga maging sequelae once some are detached, okay, from this vegetative endocarditis or valvular endocarditis. Another picture of cauliflower picture of the endocarditis. So this is isolated from a pig due to Streptococcus suis or Elisopletrix ruchopathy. Don't forget these two, no? These two pathogens in pig are the most common causes of, and this may lead to death of young. Okay, so especially yung mga nasa post-weaning or yung mga nasa grower, though it also affects yung mga old. However, in the old animal, other manifestations of erysipelatris can be seen. In Streptococcus suis kasi may type 2 pa yan, and that also affects not only the heart part, which causes meningitis. Okay, that's how you're going to describe now whether the animal is suffering from streptococcosis or erysipelatris cruciopathy infections or erysipelas. Okay. So other indications also that could differentiate from your streptococcus is the presence of arthritis. Ayan. So under yun ng erysipelatris or erysipelas infection. Okay. Okay, so another picture of a valvular endocarditis from a horse. So I have shown you 3 possible conditions where you can see vegetative endocarditis. So sa cattle, we have the pyogenes, okay, Treponella pig, we have the erysipelas, okay, and the streptococcus. And for the horses, we have the streptococcus again and actinobacillus equine. So this is the vegetative valvular endocarditis and also thickened endocardium. Okay, so dogs and cats naman. So this is how it looks like where there is an attached blood. In this portion, no. So the most common cause naman is Staph aureus and Streptococcus species in dogs. However, in cat, it's Bartonella, okay, Hensley, and your Streptococcus bacteria. Okay, so these are the common vegetative valvular endocarditis in companion animals. So upon looking at under the microscope, you will see the richness of the bacterial colonies and the fibrin. So since this is a thickened, sabi ko kanina, what could be the affected or what could be the constituent of the thickening of the valve is the valve. Syempre, it is deposition connective tissue because of continuity or the pathogenicity of the possible pathogens affecting that yung presence ng pathogens on that affected lesions or in that lesion. Okay, so this is how it looks like. You see a mirage number of polymorphonuclear cells plus the connective tissues. This particularly, we have also the fibrin kasi may blood to, no? May blood. Some connective tissues found. Okay, so meron kayong demarcations. You will notice here some of the demarcations of the lesion. Okay, the cell debris that is affected, necrotizing. Okay, so wala na kayong makita dyan. Okay, a lot of yung mga bluish dyan are the polymorphonuclear cells. Okay, and of course, some of the inflammatory cells. So since meron tayong macrophages na, medyo malalaki na siya, medyo. So this is another picture of a thromboembolism. So ibig sabihin, this thromboembolism pwedeng ma-detach that could lodge to other portion of the animal's body. So that thromboembolism can cause renal infarct once it is distributed or lodged in the kidney. And from the tricuspid and pulmonic endocarditis naman, this could trap into the pneumonia, into the lung. How? Okay, so the mitral-aortic endocarditis, systemic ang progression ng flow. While in tricuspid and pulmonic naman, pulmonary yung flow ng blood natin. Okay, so definitely this will cause congestive heart failure. Okay, so in young adult cow, this is an actual case from Shannon Martinson presentation. Okay, so young adult cow with a 2-week history of coughing. There is a minimal improvement with antibiotics. It has been observed to have tachycardia, and it died on the way to the barn for milking. So once they opened it, so they saw hemorrhage of the lungs, okay, particularly on the middle diaphragmatic cranial part, okay to, okay, doon sa may area. Okay, you will notice here the hemorrhagic part, so may congestions at the same time, darkened portion of the affected surface, okay, on the end surface of the lobe, okay. And then, of course, on the area of the heart, you will notice here some clotted blood, and of course, the vein, okay, the vena cava thrombosis. Okay, dun sa area yan, kaya nagkaroon din dito ng blood. Okay, nakikita nyo to, yan. So, it has an enlargement, okay, hanggang lumabas dito. So, it also produces endocarditis. Okay, so this is another picture of a trap. Okay, this is another picture of the trap lesion. Ayan, so it has a straw-colored fluid. Okay, so ito yung isang itsura niya. So this is the affected liver. Okay. So this is yearling with 3 months history of poor doing and inappetence. It has pyrexia and anorexia, which led to some response to antibiotic but recurrent. Ibig sabihin, pag nag-response, then afterwards, meron na naman siyang sakit. So, positive with tachycardia, muffled heart sounds, and jugular pulses. So, died on the way to the barn for milking. So, same with the last previously presented. Okay, so for the associated lesions, so that is more of the primary lesions. Now, for the associated lesions, so secondary lesions are due to fragmentation of valvular lesions causing embolism. So these lesions consist of infarctions, depending where the possible they touch, okay, lesions from the heart could lodge. Okay, it's either with the kidney, spleen, heart, or in the brain, and that is thromboembolism, and that can also be found in the iliac bifurcation in cats. Yeah, so iliac bifurcations, the bifurcations of the blood vessel. So this is how it looks like in kidney. Ayan, may infarct, but definitely may petechiation and chymosis in the surface of the kidney. We have also lodging in the brain, so this is very hemorrhagic. And of course, there is congestions of some of the blood vessels and swelling of the gyri or gyri. And then we have the surface of the spleen, in which my enlargement here or swelling, and some plaque, okay, plaques on the edges. Ayan. And the bifurcation in the iliac part. Okay. So ulcerative endocarditis. So ulcerative because it has some deep excavation or hemorrhage or dito, actual lesions or actual parang erosions, but this is more deeper than erosion. That's ulcerations. So sometimes it could be hemorrhagic yung itsura. Okay, so this occurs with chronic renal failure because of the harsh depositions of waste products. The neuremia damages the endocardium, and it appears thickened, may not have the mineralization. So in this picture, there's mineralization, but it has a very thickened, wrinkled, ulcerated, affected endocardium. Okay, so some secondary, ayan, so mga manifestations are agonal hemorrhages or subendocardial hemorrhages. So this can be found post-mortem or depending on how long the animal had been died or suffered from parang mga tamponade, yan. So depending on the hemorrhage that could happen here. In here, you will notice there is rupturation of the chordae tendineae also. Okay. So another is heartworm disease. So this is a population of heartworm, adult heartworm. Ayan, so kung titignan nyo, no, the heart, ayan, the heart shape is already different, okay, from a simple para siyang heart ng patusok. But this is medyo globus because of the obstruction of the numbers of what they call this one, heartworm. Yeah, so that is how it looks like. And the extension of this heartworm can be po until dun sa part ng could kill the animal. Okay, it could kill the animal. Okay, so ano yung common na binibigay to prevent the larvae? So are you familiar? Di ba you have your pharmacology na. So ano nabanggit na drug for the heartworm, anti-heartworm? Are you still there? Can you still hear me? Are you still with me?
Yes po, Doc.
Okay, o ano, na ba sa pharma? Nabanggit na ba yung drug or sa para, yung drug against heartworm? Oh, assignment. Meron yan. Pwedeng banggitin kasi sa para, di ba? Natapos nyo na ba ang helmintology? Not yet. Kukunin nyo pa lang. 4th year, tapos nyo na. Right? Hello? Oh, tapos na. Are you familiar with heartworm? Oh, okay, familiar kayo. So, alam nyo kung paano siya i-prevent or control. Kasi if, sige, sa aso. Yes, Miss Nicole, go on. No. It's a parasite. It's a helminth. It's a worm.
Doc, yung
Have you
heart
heard?
guard po. Yung binibigay po na heart guard.
That's one. Heart guard, pero not for the adult. You know, it's more of pwede microfilaria. However, it could prevent. Now, the problem here is that kapag ganito ng madami, no, very crucial magbigay ng gamot na. Kasi one effect is that yung mga death, it could kaya nga, if possible, as early as possible talaga may preventive treatment na binibigay for the microfilaria stage pala. I guess that ends for the endocardium. The next topic will be congenital, but this will be discussed on Friday. Hopefully Friday sana, no? Oh yeah, kasi 9 o'clock pa naman yung aking, ang aking meeting on Friday. So we will have a discussion congenital. So hopefully matapos naman natin congenital. And kung ano pa yung madadagdag. So, we have, sabi ko nga, meron na kaming ngayon. Ayan. Please inform na lang others that on Friday, medyo agahan na lang nila para makatapos ulit tayo na mas maaga for our discussion. Okay? Hello?
Yes po, Doc.
Okay, sige. Okay, so see you next meeting. So I hope you heard, you learned something kahit limang term and 5 conditions, remembering endocardium. And of course, what Jillian mentioned about the pericardium and what Kides, sino pa ba yung nag-discuss on the Kides, Nicole, and I think meron pang isa, no, doon sa myocardium naman last time. Okay, so next meeting we will talk about the congenital defect of cardiovascular or the heart. Okay, the heart. Okay, so thank you very much for today. So pasensya for the yung kulang talaga tayong time. So we will try to finish ano man yung ma-finish natin, but hopefully I am targeting up to respiratory or until digestive before the exam. Ayan. So, please, yung rest of the time nyo, prepare nyo lang yung pinapa-prepare ko for the laboratory or and others. So, kung sa inyong mga report, kung meron pa kayong dadagdag dun sa mga in-upload nyo. Okay? So, thank you very much for today and see you again this Friday. Participate in our global discourses. Okay?
Thank you, Doc.
Thank you po, Doc.
Doc.
Wow, hindi kayo nakikinig eh. Okay, sige. See you again.